everybody. So today's topic is on dental caries, and my contents would include an introduction, a definition, the theories of dental caries, that is the early theories and also the most accepted theory we have. Then we'll have a classification. We have a variety of classifications. Then the etiology, the histopathology, that is the zones of enamel caries and the zones of dental caries. Then we'll have a proper diagnosis of how caries can be detected. Then we'll have caries risk assessment, methods to control, management, followed by the conclusion. Okay, so first we'll see the term the dental caries. It was first reported in the literature in the early 1500s, that is the almost 1500 to 1634 and all. The term dental caries was coined, and it means that according to Latin terms it means decay, and it is reported to be one of the oldest and the most common diseases of the oral cavity. So it is also a prevalent chronic infectious disease which is resulting from the tooth adherent microorganisms or the cariogenic bacteria, mainly the Streptococcus mutans, that metabolizes the sugars to produce the acids which can cover time demineralizes the tooth structure. Okay, so this is the introduction regarding the dental caries. Now coming to the definition, we mainly have two definitions, that is one is the Schaeffer's definition and one is the WHO definition. So whichever is easy you can just memorize that, and the most accepted can be the Schaeffer's classification. So there we have to remember that it is an irreversible microbial diseases of the calcified tissue of the teeth, that is the enamel and the dentin, or the calcified portion of the tooth, where there is demineralization of the inorganic portion and also there is destruction of the organic substance of the tooth. So here we can remember that there is inorganic substance, there is demineralization. If you can't remember, you can think that demineralization, there is an I, and there is an inorganic portion I, you can remember, and also there is a destruction of the organic substance which often leads to cavitation of the tooth. So that is according to the Schaeffer's definition. Then we have other definition, that is WHO definition, which is a localized post-eruptive pathological process, that is which is localized to one tooth and after eruption, that is post-eruptive, a pathological process. It's not a physiological process of the external origin that is involving the softening of the hard tissue. In the other Schaeffer's definition, we had the word demineralization and destruction, and here it is only the softening of the hard tooth, and also it is proceeding to the formation of a cavity. Okay, so this is the WHO. These are the two accepted classifications, it is Schaeffer's and the WHO classification. Then we have the dental caries. We have the early theories regarding the dental caries. We have early theories and we have the late theories. So early theories, we mainly have four theories. Okay, that is, you can remember it as PET-C. Okay, that is the parasitic theory, that is the endogenous theory. Then we have the legend of worms and also the chemical theory. So the legend of worms, that is the most very old theory, where it was believed that around the 500 BC, when it was the word it was coined, it is that theory which was known that time. This is the legend of worms, that is the worms are the infectious causes for the causes for decay are the worms. Then we have the other theory, that is the endogenous theory. The endogenous theory was according to the Greek physicians, where they mentioned that this decay was only because of a inherent endogenous pathogen that was present within the tooth, or the internal action of the acids. We can tell internal action of acids and also a pathogen that causes the decay according to the endogenous theory. Then we have the chemical theory and a parasitic theory. Parasitic theory is a microorganism related theory, and chemical theory is that there is an unidentified chemical agent. Okay, it was not identified. So these are all the early theories which you can remember it as PET-C. Okay. Coming to the accepted theories, that is the accepted one is the Miller's chemicoparasitic theory or the acidogenic theory, which was coined by Miller in the year 1882. It is always a viva question, like who coined the term acidogenic theory and in which year it is. So it was a D. Miller in the year 1882. So according to this, according to Miller, it is a chemicoparasitic process where an unidentified chemical as well as a parasite is involved in the formation of a dental decay, and it consists of mainly two stages. That is, we have decalcification of the enamel, which results in the total destruction and decalcification of dentin. So the preliminary stage is, so basically this is two stage. We have primary and we have secondary stage. Primary stage, there is decalcification of the enamel and decalcification of the dentin. And in the second stage, we have the dissolution of the softened residue. Okay, this is the Miller's chemicoparasitic theory. So according to Miller's chemicoparasitic theory or the acidogenic theory, there are mainly three factors in the caries process. We have microorganisms, carbohydrates, and also the acid production. So the unidentified chemical that was previously mentioned in the early theory would be the acid that is produced because of the reaction of carbohydrate with microorganism, which we'll be dealing later. So one main drawback of this theory is that it was unable to specify the or to explain the predilection of a specific site of certain caries. That means we can we can tell the drawback as it was unable to explain the predilection of specific site. It means that Miller proposed a theory where he could not specify the site of the dental decay or the dental caries. Okay, that is whether it is a pit and fissure or it is a smooth surface caries, or if it is in enamel or in the dentin or even in the root. So according to this theory, we are not very clear about the specific site of the dental caries. So that is about the Miller's acidogenic theory or the chemicoparasitic theory. Okay. Next we have is the proteolytic theory by the Gottlieb and the Gottlieb. Okay, that is in the 1944. Here the organic material or the protein elements are the initial pathway of invasion. So here we have to know that organic material, protein, the two terms by Gottlieb is the organic material or the protein is responsible for the dental caries or for the invasion of the microorganisms to the enamel and following the dentin. Then by Schartz also, he came up with the proteolysis, not only proteolysis, but with a chelation. The proteolysis chelation is the simultaneous microbial degradation of the organic components and the dissolution of the minerals of the tooth by the process known as chelation. Okay, so there only the proteins and the organic material was present in the proteolytic theory. It is by the process of chelation, it causes decay, is what Schartz proposed in the proteolysis chelation theory. So we need to know what is a chelation. So proteolysis is the breakdown of the protein material by adhering to the proteolytic, the protein cell membrane and also the organic portion of the tooth. But what is the process of chelation? It is actually the complexing of the metal ion to a complex substance. Already it is a complex molecule. To that a metallic substance is added or it is bonded by the process of chelation, and the bond between the complex molecule can be, this is the complex molecule here, plus a metal, can be any metal. Okay, this there is a bond here, that bond is the covalent bond. So this is what is called as chelation. So this in after proteolysis, there occurs a metal is also attached by the process of chelation, is what is Schartz proteolysis chelation theory. And this metal or an element, it can be, is proposed to have, it is calcium, Ca2+. So this drawback of this Schartz theory is that saliva and plaque do not contain substances in sufficient amount to chelate with calcium. So this complex molecule should be present so that it can chelate with the metal or the element. So they have told that there is no such complex molecule in the saliva or in the plaque for a metal or a element to chelate with. So that is what is told as a drawback in this proteolysis chelation theory. Then we have the Egler's Lura. In 1967, he proposed the sucrose chelation theory. In this, he told that the sucrose itself, and it is not the acid that is derived from the substrate, causes dissolution of the tooth. And it forms, by chelation, it forms calcium saccharides. Okay. So the drawback of this theory also is that it is the saliva has an abundant amount of inorganic phosphate for this bacterial utilization. So they told that there is a depletion of phosphate and then there is a chelation taking place. But the drawback is that there is more amount of or an abundant source of phosphate which cannot be easily depleted. So there is no chance for other metals to come and chelate with this membrane. So that is what they have mentioned in that the saliva is an abundant source of inorganic phosphate. This you can mention anywhere because this is always again a viva question. That is the way saliva is rich in inorganic phosphates. So it cannot chelate with other calcium or any other metals or elements. So that is about the sucrose chelation theory.